There are plenty of good reasons to stop smoking. Most smokers know they need to quit for the good of themselves and their loved ones. The big question is, once you quit, how do you get through that period of withdrawal when you have strong urges to smoke? One of the most common treatments is nicotine replacement. This uses nicotine the way medicine is used, in measured doses. The brain continues getting some nicotine, but in smaller amounts, not as quickly, and in a much safer way than using tobacco.
It was really helpful. You know, I got enough replacement that I was never dying to have a cigarette.
As the withdrawal symptoms become less intense and easier to cope with, the amount of medicinal nicotine is gradually decreased. If you've tried nicotine replacement therapy in the past without success, you may not have been on the right dose or had the right combination of medications.
One of the things they were very mindful of here was determining what that dose needed to be. So if I needed more than one patch, which I did, I got more than one.
Don't give up on it. Talk with your healthcare provider. Nicotine replacement therapy might work on your next attempt to quit. Additional help has recently become available. Thanks to new ways of looking at the brain, there have been some important discoveries about easing withdrawal symptoms.
There are some newer medications different from nicotine replacement therapy. One that's been around for a number of years called bupropion stimulates the release of a chemical called dopamine in the reward center, the area of the brain that causes pleasure. And when people smoke, this dopamine is released. And dopamine causes that pleasurable feeling and reduces then the craving and withdrawal symptoms people get when they stop using nicotine. We do use bupropion and nicotine replacement combination fairly frequently, and there's pretty clear evidence that that combination is better than treatment with nicotine replacement alone. A newer drug called varenicline works in a much different way. It partially stimulates the nicotine receptor, and so it mimics some of the effects of nicotine and reduces withdrawal. But when it's in that receptor, when that drug is connected like a lock and key, it blocks that receptor so it can't be stimulated any further by nicotine. And those two effects combined tend to help people stop smoking by reducing withdrawal and reducing urges to smoke.
Studies have shown that these medications double the chance that people will stop smoking for good. As with any medication, discuss possible side effects and risks with your healthcare provider. Serious psychiatric symptoms such as changes in behavior, agitation, depressed mood, thoughts of suicide, or attempts at suicide have occurred in people being treated with varenicline. If you are taking varenicline, watch for these symptoms as well as for any worsening of pre-existing psychiatric illnesses. The symptoms may be complicated by nicotine withdrawal in people who quit smoking, but the symptoms have also occurred in people who continued to smoke while taking varenicline. If you are taking varenicline, you and your family need to watch for these symptoms and to report them immediately to your healthcare provider. Healthcare providers can also provide support to help people stay tobacco-free. Many providers are very well informed about the latest ways to help people stop using tobacco. It's very helpful to spend time with someone who understands your situation and can help develop a plan tailored for you. Treatment can make all the difference. The combination of medications and working with a professional can increase your chance of quitting by 4 times. This could be the time you stop smoking for good.
The Mayo Clinic Nicotine Dependence Center is a world leader in helping people stop using tobacco. It offers outpatient treatment and a residential treatment program. Call or visit our website to find out how Mayo Clinic can help you quit smoking for good.